Good morning friends, I am Dr.Pritesh, Junagade, Haematologist and Oncologist practicing in Nashik and Mumbai. I have been trained in Haematology and Oncology in UK for 7 years, and today I am here to tell you more about sickle cell anemia. It's a very interesting disease, sickle cell anemia. When a patient is diagnosed with sickle cell anemia, they come to me, they are lost. And that's what prompted me to do this short film about sickle cell anemia, so that the misconceptions which are there in our society, especially in our Indian society, I do want to prove that they are wrong. Sickle cell disease is a treatable disease. Many of these patients will have a normal lifespan if diagnosed early and treated properly. So let's start with what is sickle cell? What is sickle cell anemia? Well, the exact meaning of sickle is a type of red cell defect where your red cells, which is normally oval in size like this, becomes a hook shape like this, or a sickle which the farmers use. That shape is attained by the red cell because of some genetic defect in the hemoglobin. You get sickle cell anemia, a patient with sickle cell anemia, he has inherited the disease from his parents. Both the mother and father will have an affected gene, and those two genes, when they come together in the children, they have sickle cell anemia. So normally the lifespan of a red cell is 120 days, meaning a red cell should stay alive for 120 days in your body. In sickle cell anemia, because of the odd shape, it dies earlier. Maybe in 30-40 days, the red cell is destroyed, and that's how you get low hemoglobin. So your hemoglobin is low in sickle cell anemia. How it is diagnosed? How do you know that you have sickle cell anemia? There are common presentations, common symptoms. The first amongst them is anemia, a low hemoglobin. Low hemoglobin can cause various symptoms like weakness, fatigue, loss of energy, pale look. Then the second common complaint is yellowness of the eyes, which we call jaundice. Because the red cells are being destroyed earlier, you get jaundice or yellowness in your eyes. Many children have repeated attacks of jaundice since childhood. Number 3, many of these patients get painful crisis, or they have got pain in their joints, especially small joints. In some patients, big joints like your elbow joint, your shoulder joint, or your back do pain repeatedly. Maybe every month, in some patients twice a month. They do get repeated attacks, and they can be misdiagnosed as arthritis. Number 4, many patients have repeated infections because of lowered immunity. There are other rare presentations of sickle cell anemia which we need not go into the details right now. If you have got any of these symptoms, and if you go to a doctor, they will do a simple blood test called a CBC, and if they have a look on the slide of how the red cells look like, this sickle cell anemia can be very easily diagnosed. It is confirmed by doing a test called hemoglobin electrophoresis or HPLC, and then you can also diagnose the various subtypes of sickle cell. Sometimes sickle cell anemia is associated with thalassemia. So sometimes you get a combination of these two diseases. Diagnosis is pretty easy nowadays with the new machines available throughout India. The presentation of sickle cell anemia is very classic. But having said this, I have diagnosed sickle cell anemia for the first time in some females up to the age of 34 years. This is not a good sign. It means we are not diagnosing sickle cell anemia early. And for that, we need public awareness, education. Again, I will have to tell you that sickle cell anemia is common in certain populations, especially in certain tribal populations. Because if you've got 50% of sickle cell defect, which is called a sickle cell trait, it protects you from malaria. And this is a very advantageous position. But if you have a sickle cell disease or a proper sickle cell problem, it will not protect you from malaria. So we have seen how sickle cell is diagnosed. Now let's see what treatment options are available for sickle cell anemia today. The commonest thing for sickle cell anemia today is to take a tablet called folic acid for the rest of your life that can reduce the damage to your red cell. Number 2, in very bad sickle cell patients, bad meaning if they are getting repeated infections, repeated joint pains, and they might have to change the joints. In certain patients, we can do stem cell or bone marrow transplant as well. Number 3, there is a new tablet capsule which is available, which is hydroxyurea, which can be taken at certain doses and does help patients of sickle cell anemia in reducing the complications. Many parents do ask me, can we treat it completely? My answer is no, unless the patient needs a stem cell or a bone marrow transplant. But we need to tell the parents that this is a disease which can be treated. The child can have a normal life, they can go to school normally, play normal games, and they can lead a normal adult life as well. There are certain precautions you need to take to prevent the attacks of sickle cell, which is painful attacks, is to drink plenty of water, avoid extreme cold, avoid extreme dehydration, keep yourself fit and healthy with a good diet, and don't overexert yourself. And take proper medications which have been advised by a hematologist, and in this way we will prevent many long-term complications of sickle cell anemia and will help these patients to lead a normal life. Well, my friends, there are other things which I can tell you, but due to constraints of time, I am going to stop here. If you need any specific information about sickle cell anemia, please visit our website, which is there on your screen now. Thank you for your hearing and have a good day.